What about the eyebrows? So for the eyebrows, we can have the use of botulinum toxin in a very, I might say, dangerous area. So this, I suggest to use this injection only if you are expert injectors and you know exactly what are you going to do. Why? Because, as I said before, from the lateral corrugator, if you inject the Botox, the botulinum toxin, this can migrate and go and block the elevator of the eyelid. Especially these 2 points in black that you can see is very dangerous. What we're going to block here, mainly we're going to block the orbicularis muscle, which is responsible when you squint to move the eyebrow in the lower part. Again, I would suggest to use 2 units per side maximum, and in case add some units in the checkpoints after 2 weeks. But again, don't take the risk if you're not secure what you're doing. This works very well, of course, in combination with the frontalis muscle treatment, because otherwise, if you block that part, the frontalis works, the risk is that you have the devil's look. So the eyebrows will really go high in a diagonal position, which is very horrible for the patient. Again, as you can see here, the patient has been treated for the frontalis, but you see how the tail of the eyebrow has been lifted in a very natural way. The position of the eyebrow was more horizontal before and more diagonal in the control picture. Filler. Strange enough, we can still use filler for our patient. I suggest an IG prime filler, but a very limited amount, 0.2, 0.3 cc per side. How does it work, the filler? So this is the way you should inject the filler. From the lateral part, you go inside, you can use both the cannula and the needle. You don't have major vessels in this area, so again, even the needle is safe. What does it do? I use this example always when I explain the filler in the eyebrow. If you think about the breast and you want to lift, if you inject the volume, the nipple will be lifted because all the projection of the nipple and the breast will be pushed up by the implant, right? This is the same thing. If we inject something under the eyebrow, the lifting effect will move the eyebrow in a higher position. Again, if you inject too much, the risk is that this will migrate downwards and then create heaviness on the eyelid and droopy eyes, which is not something that we want. Again, this is more a technique for advanced injector. Keep it always as a second option after the botulinum toxin if it didn't work for you. We have also the possibility of threads. I need to tell you that I'm not a big fan of threads. I never use them. I don't think they work. And unfortunately, I found a lot of complication after threads, especially if I had to perform a facelifting on a patient with a thread before. That is really, really a problem for me. Is a temporary effect. Usually after 1 month, the patient comes back to you and say, I don't see any major result. You can create a lot of swelling, especially in this area, and is also quite a painful area to do the threads. So some patients might complain about that. But this is usually the direction that you can inject the threads to lift the tail of the eyebrow. We can also have surgeries. We can do a direct brow lift, which is an incision at the edge of the eyebrow. Usually the scar is exactly at the edge of the hairline in the eyebrows and is not that visible. This is, in my opinion, the best option if you really want to see a very nice lifting effect on the eyebrow. We have the temporal lifting, which is an incision in the temporal area where we can lift the whole skin. Will lift the temporalis fascia, and we pull the temporalis fascia, we pull the skin, and of course, the consequence is the lifting of the tail of the eyebrow. Or we can have the endoscopic lifting, where the incision is much smaller, is hidden in the upper part of the forehead at the beginning of the midline. In this way, we create a tunnel till the end. Let me show you with an arrow. Till the end of the eyebrow, okay? And then with a special suture, we take the tail of the eyebrow and then we lock it to the temporalis fascium in this area. This is again for advanced surgeon also to perform this.